Hi, I'm Dr. Rosanna Means, the founder and president of Healthcare Without Walls. People ask me sometime, what is gap care? Say you wake up in the morning, you think you have a strep throat, and if you are the average person that has a doctor and an insurance coverage, you would pick up the phone and call the doctor's office and arrange to be seen that day to have somebody check your throat and, if needed, give you a prescription, take a test, and wait for the results in 24 hours. If you're homeless and you don't have insurance, or even if you do have Mass Health, you might not have a phone to call the doctor. It may be that you don't speak English as your first language. It may be that you don't actually know where the doctor's office is or how to get there. And you certainly might not have transportation to get to that office. And when you get there, it may be that because you slept in a shelter last night or outside, you might not smell so great, or you might not look so good. And so you may sit in a waiting room with other people who may look at you funny or make you feel embarrassed or ashamed. The small little insults of every single day are what beat these women down and make them demoralized and depressed and discouraged and feel hopeless and powerless. The instructions that we hand out in the emergency room, we say things like elevate your leg if you have an infection of your leg. Well, where do you elevate your leg if you're leaving the shelter at 6 o'clock in the morning and have to walk the streets all day? What do you do if you're a diabetic and you need to take insulin but you don't have a refrigerator? What happens if your phone keeps getting stolen or gets smashed? What happens if you're supposed to make an appointment with your doctor, but you got beaten up the night before? Those are all the little steps that can get in the way of a simple thing like waking up with a sore throat. We've worked with these women for decades, and we know that these women, it's not that they don't want to get better, it's that it's a mountain to climb every single day. And when we meet them, we get basic information from them. We find out what their primary language is. We find out if they need a primary care. If they don't, we will find a primary care for them, and we will go with them to these appointments. We will accompany them to the doctor's office. We will explain to the judge what their situation is with their landlord, that they're trying to get into a place or they're about to be evicted. We do all those little steps to mind these gaps so that each day their life is just a little bit easier. We cannot change the fact that millions of women and children are homeless in the United States. That is society's problem, and society has to decide to change that problem, and we need the political will to make that happen. But when they can come see us, when they can walk in and we greet them with a smile and a welcome, we're just happy to see them, that they're alive, then we can make a list of all the things that are going to help them get better. We know from experience they will pick up the pieces and they will move forward. We have seen it happen over and over again. These women are stronger and more resilient and more courageous than anybody gives them credit for. And we have seen it, and we can swear by it. So that's what giving gap care is, and it's desperately needed for thousands and thousands of women and children in this country.